Well, travel in the U.S. gets a yellow light as the CDC releases new guidelines for people who are fully vaccinated.
Here to answer your questions is Dr. Erica Shenoy, Associate Chief of the Infection Control Unit at Mass General Hospital. Doctor, thank you so much for joining us this morning.
Thank you. Good morning.
Well, the CDC says people who have received both doses are at low risk for infection when they travel, but the agency was careful to add it does not want anyone to take a trip right now. It's really confusing. What's the concern here?
Right. So, well, they updated their guidance yesterday for fully vaccinated individuals, recognizing that both they're at low risk for infection and unlikely to transmit the virus as well. There's still the challenge of traveling, which introduces mixing of individuals, interacting with more people than you normally would. And those are opportunities for transmission of the virus.
Okay. This is Easter weekend. Spring break for most public school kids starts in 2 weeks. What impact does that all have on the numbers here in Massachusetts?
Yeah, so that's a great question. The last time we had some vacations, remember Thanksgiving and Christmas and New Year's, those were attributed, some of the case increases were attributed to travel and gathering that happens when people go on vacation. We're in a different place now than when we were in November and December, in that we have more people vaccinated and it's warmer weather. So hopefully some of the activities that people do engage in if they're going to be on vacation will be outdoors, which is lower risk. That said, as we just discussed, the more traveling, the more interacting with people, the more opportunities for transmission. So we'll see how it all pans out. And hopefully when people are traveling, if they do travel, they're doing all the same things that we know we have to do with masking, distance, avoiding crowds, and doing hygiene.
Let's hope so. Okay, the CDC's director, Dr. Rochelle Walensky, was back in Boston this week to tour the new mass vaccination site at the Heinz Convention Center. You know her personally from her days at MGH. We want to ask you, what was your reaction to her emotional plea asking Americans to hold on a little longer and sharing her worries about, quote, impending doom?
Well, I think of this as a very frank warning, and it's a warning that's supported by the numbers that we're seeing around the country and here in the Commonwealth, where prior we were having a really nice decline in our cases, percent positivity, and hospitalization. And over the last several weeks, we've seen an uptick in all of those metrics. And while we're in a great place in terms of what we have to look forward to, with vaccinations being incredibly effective, more and more people being vaccinated, and spring right around the corner, we're not there yet. And so what we would all hate to see is that the momentum that we've achieved so far kind of stalls and then potentially reverses. So we have to keep moving forward, and hopefully we will get there, but we have to hang on a little bit longer and stay the course.
Yeah, those comments go under tough love. We needed to hear it, I guess. And on Monday, more residents in Massachusetts become eligible for shots. The new groups include adults age 55 and older, the people who are age 16 and older with one comorbidity. New on the list, type 1 diabetes, substance abuse disorder, people who are overweight. Why does COVID-19 cause serious complications for so many different kinds of medical conditions?
Well, I would file this under us learning a lot about COVID every single day. And what the CDC and others have been doing is synthesizing emerging data as it comes, and then finding associations between your risk of severe outcomes and certain underlying medical conditions or other demographic factors. And while we may not know the exact mechanism by which each of these, for example, causes you to have a more severe outcome, become hospitalized, or end up on a ventilator, it does allow us to do things in the interim, which is prioritize vaccination, could prioritize certain therapeutics. And then from a patient-doctor perspective, if we know some of these risk factors, we can work with our patients to do whatever we can in the interim to mitigate those risks.
Okay, Dr. Erica Shenoy, Associate Chief of the Infection Control Unit at Mass General Hospital. Thank you so much for joining us this morning.